Congratulations.
Hello. Hello and welcome to today's live section. We are going to dive deeper today and talk about everything OSCE. By the end of this section, you will know everything you need to know about OSCE. So stay tuned. If you can tap and share, that will be lovely. I'm on TikTok live as well. So if you see me looking on the other side, I am checking on TikTok as well. Hello and welcome. Those on TikTok live, kindly let's keep tapping and share. Let's share this session to everyone. We are going to talk about everything OSCE today in all the fields. So kindly share. Hello and welcome. Those of you on TikTok, kindly share this live to your colleagues and also meet me live on YouTube, Nesobapre. Let's talk about everything OSCE today. Whilst we wait for other people to join, kindly share. Hello and welcome everyone. Let's try and tap on the screen and share this live to our colleagues. Tell them to meet me on YouTube live now, Nesobapre, as we dive deeper into everything OSCE. Those of you on TikTok, kindly come meet me on YouTube so that you'll be able to see the screen I'm sharing. If you can meet me on YouTube, please go on YouTube and let's see for ourselves together. Hi, Samuel. But I'm just another guy, just another guy. If I told you wouldn't tell me, sacrifice it all. But I'm just another guy, just another money I want. Give me day one, let it crypto, dollar city safer. Call me, let's talk, and I'll go see you later. Lucky champion, they no fit to bank down with them now in the final boss. 1,000 bullets to my body on from. Samurai swings, what the situation. I want the money long, you know, fit to take them with the party land. Obsessed to my borrow, concerned with my liberty. Options of a flow, it's gonna last, so change my energy. Rain, I never go down. Never step compose my apology. Everything would have been lovely. Just another guy, just another guy. If I called you, wouldn't tell me. Hello and welcome. So today we are going to talk about OSCE. We are going to dive deeper into the overview of OSCE. And for us to also be able to pass OSCE once and for all, we need the fair understanding about the station. We need to know what to expect as a nurse, as a midwife, as a nurse associate. What are you going to expect when you get to the stage of you writing OSCE? Before that, we can acknowledge that OSCE is for overseas trained nurses, midwives, nurse associate, mental health nurses, children's nursing. These category, the UK NMC gives you the opportunity to be able to join the register with your certificate that you've acquired. Those of you on TikTok Live, kindly join me on YouTube. Join me on YouTube now so that you'll be able to see the screen I will share. Today we are going to learn deeper understanding about OSCE. So every questions that you might have, you can pop it in the comment section as we go on. Join me on YouTube now, Nurse Obapre. Perfect. So before we begin, as an overseas trained nurse, as I was saying before, the NMC requires you to write a test of competency exam to prove that indeed whatever certificate that you have uploaded on the portal is legit. So when you create an account as a nurse, midwife, or as a nurse associate, whatever category that you find yourself in, the UK NMC expect to test your knowledge on that category. So if you are a nurse, you are going to write test of competency exam for nurses. If you're a midwife, you are writing for a midwife. If you're a nurse associate, you are writing for a nurse associate. Those of you on TikTok Live, kindly join me on YouTube, Nurse Obapre, and let's go on and on about the whole process. I'm going to be sharing the screen, so it will be to your advantage if you join me on YouTube Live. So just like I was saying before, this test of competency exam is to prove that whatever certificate that you have uploaded saying you are a nurse to their page or to their website is going to prove you right. So the test of competency is to show that you are a nurse. Yeah. We have two of these tests of competency. We have CBT, which is computer-based test. That is literally a theory exam that you are going to write as part of your preparation. CBT is in two parts as well. So it's a theory test, but you have two parts. You have the clinical and the numeracy. So basically, you're going to have like an option to do the calculation aspect of nursing, the drug calculation and all of that. And also you'll be given the chance to also answer a few questions clinically, what you are supposed to expect clinically. There are some scenarios that they will put across in the questions and they expect you to answer it. So that is what CBT is going to be about. The CBT is literally just a theory exam. And if you go, you write your exam there and then you get a printout of your results and you'll be able to know whether you've passed or not. So that is how you go about with the CBT. The exam is solely about your field. The exam is solely about your field. So if you are a nurse, you are writing CBT for nurses. If you're a midwife, you are writing for a midwife. If you are a nurse associate, you are writing for nurse associate and so on. So let's now get into OSCE. What is OSCE? OSCE is literally the practical aspect of the test of competency. Those of you who just joined my live session on TikTok, you can join me on YouTube so that you'll be able to see the screen I'll be sharing in a minute. And then we all dive deeper into the presentation. So with the CBT, if you are able to pass CBT, it takes 2 years for it to expire. And then OSCE as well. You have 2 years in between if you write one before the other, okay? So OSCE is the practical aspect of your exam. The difference between your licensure exam and OSCE is literally because you are going to talk. Every step of the way, you will be talking. So if you pick something, you are going to talk about it. If you come across anything whilst you are presenting, you need to explain everything to the assessor. That is what makes OSCE quite tricky. So before I say anything, let's now go into what actually OSCE, before OSCE and everything else about OSCE. Let's go into that. Okay, so in preparing for your OSCE, you are able to see this. All the materials are on the NMC website. You are able to find all these materials on the NMC website. So as a midwife, you'll be able to find everything on the NMC website. If you're a nurse, you'll be able to find it on the website as well. Just go to nmc.org.uk and then you can type OSCE and you search for everything that you want or anything that you're looking for in your preparation. So they've made it possible for all of us to be able to see the concept of OSCE. Right, can you see the screen I'm sharing? Kindly type it in the comment section for me on YouTube. Those on YouTube, are you able to see the screen I'm sharing? Those on YouTube, please type in the comment section, are you able to see the screen? Yes, okay, perfect. Thank you very much. Okay. So, this is before preparing for your OSCE. What are the things that you need to know about it? So, as I was saying before, those of you who joined earlier, the part 1 is the computer-based test of the test of competency. And then you have the chance to do part 2, which is the objective structured clinical examination, OSCE. So this is what the test of competency is about. How do you prepare for your OSCE? Everything that you need to know, every material is on the NMC website. Just for all of us to know, every material is on the NMC website. So you can go and download it. You can download the marking criteria on each field. So as a nurse, midwife, nurse associate, you can download the marking criteria on your field. Every document I'm going to share today is literally downloaded from there. Now, what to expect in the test center? This is what you will see. The test center is designed in a clinical way. So just like you see from here, there's just a tiny cubicle or a tiny room with the patient's bed. The patient can be a mannequin, or you can get an actor in some of the stations. And then you have a timer in the station as well. You have all these bits and pieces. So you have the call bell if there's oxygen socket and all of that. The assessor will be sitting here. So it's like a role play room. So this is how the OSCE room looks like. Okay, so just imagine it in that sense, that whenever you talk about OSCE in the sense of presenting, you'll be presenting within this small room. So everything will be accessible for you. Most of the articles that you will use will be readily available for you to use whenever you turn. Those of you who just joined me on TikTok, kindly join my YouTube live session now, so you'll be able to see this screen I'm sharing and everything, okay? Join my YouTube now, Nurse Obapre. Okay, so let's continue. So just like I was saying, everything is accessible for you. So you can have the mannequin on the bed. Depending on the station you are going to do, you can have the mannequin on the bed. And some stations you can either get an actor. An actor will come and then act like your patient, and you can present as well. So everything you will do is going to be within this room. So when we talk about making OSCE simple, we make sure that we imagine this room. You are not taking any step further away from the patient. Everything is literally here. And then you have the camera on you. The assessor will be there to supervise you in case you are presenting on a performing station. If it's a silent station, the assessor will not be there with you. There are some equipment that you come across. And one thing that is essential about OSCE is the fact that you'll be able to get all these explained to you. So before you begin your presentation, the assessor will tell you that this is the call bell, this is the bed control, this is that, this is this. So the vital signs monitor, everything will be explained to you before you begin the presentation. That is to say that OSCE is not overwhelming. OSCE is not overwhelming. So everything will be given to you. Everything will be explained to you before you begin the whole process. The assessors will come down and explain almost like every gadget to you for you to be able to get a fair knowledge. The reason being that you are internationally trained. So there are some of the things you might not have a clue what they are. If this is there, you might not know that this is a call bell. You get what I mean? So everything is explained to you. Any question up to this point? Any question up to this point? Those on YouTube watching me live, any question up to this point? Any question up to this point? Yes. Is there any question? Please type it in the comment section if you have any question. All right. Let's move on. The OSCE is 10 stations, and in total, you are going to present about within 3 hours. In 10 stations, with all the 10 stations, you are presenting within 3 hours, and it's not going to be more than that. Every station has got the allocated time to it. Every station has got the allocated time. So most of the stations that you would see would have like 6 minutes, 8 minutes. I think the highest timing so far is 21 minutes with the 2 stations fused together for nurses. That's wound assessment and ANTT. So you have 21 minutes to complete that station. So basically, every station has got their allocated time. And according to this, you are using at most 3 hours for all your presentation. So for nursing, for all nursing fields, you have 4 stations. And these 4 stations are scenario-based. You have 4 stations together. That is like a scenario-based. You can get these 4 stations under one condition. You can get these 4 stations under one condition. So you can have pneumonia, you can have diabetes, you can have homelessness, and all sorts. We will go into that, and then you see all the scenarios that you are likely to get in your OSCE. But you have the 4 stations, which are the scenario based, and then you have another 4 station, which is clinical. You are doing 4 clinical stations, and you are doing 2 other stations to check for your professional value, and then an evidence-based practice station. So the first thing we need to put at the back of our mind as nurses, we have the API. We have the API. So for each station, you will be given a warning 5 minutes before the station must be completed. So when you are presenting on a particular station, in order not to get you caught in the midst of misunderstanding or pressure, you will be notified that you have 5 minutes left. That's what it says in their document. So as soon as you raise your head and notice that you have 5 minutes left, that is when you would know how to really present. It's either you go as quick as possible, or you probably have to talk about the salient stuff and hope that you pass. Okay, so you have the API. The API is a person-centered assessment. Planning is the P, and then implementation is the I, and evaluation is E. So you have API about one scenario, and you are going to present on all of this. Before we go into what to expect in the API, let's get this first. OSCE can either be a performing station or a silent station. You can either get a performing station or a silent station. When we say something is performing, these are the ones that you will be acting. These are the ones you'll be talking whilst you present. If you pick an article, if you pick something, you are going to talk about it. That is performing station. So the videos that you see online that talks about, I can confirm the scene is safe, I'll provide privacy and dignity, all of those things are performing stations. They are stations that you would have to talk. And then we have silent stations. Silent stations, you will just be timed, and then you start writing whatever, or you start doing whatever is allocated to that station. And as soon as the time is up, you will then be able to proceed to the next station. So the assessor will then come for the sheet. That is one thing we need to know. That is one thing we need to know. So the API has the assessment being a performing station, planning is a silent station, implementation is a performing station, and then evaluation is a silent but verbal station. It's not as you present like the assessment, is more like a verbal station than a performing station. You'll be talking and handing over the patient's care to whoever is taking up from you. So you'll be talking, but you are not presenting like the assessment and implementation. Does it make sense up to this point? Those of you who are watching me on TikTok, we are live on YouTube, Nurse Obapre. Kindly join me now so that you'll be able to see the screen I'm sharing. So those of you here on YouTube, do you understand up to this point? Okay, thank you. Right. So you have the API out of the way now. Now you have 4 of the remaining stations are the skill stations. These are to test your practical clinical skill. So you have all these stations to show some things that you are supposed to be doing or you are supposed to know as a nurse. So we'll go into what the clinical skill actually entail for nurses, nurse associates, and midwife. We will go into it so that you'll be able to know what clinical skill am I supposed to expect. Okay? So put it at the back of your mind. Now we have 8 stations now. The first 4 is the API for all nursing, and also for midwives, we have the API, and then we have for the nurse associates, we don't do planning. So we have AI for nurse associate. Nurse associates do not do planning, so you have the AI, all right? And then you have 4 clinical skills. As a nurse, as a midwife, you have 4 clinical skills to do. And these 4 clinical skills are practical clinical skills just to test your knowledge in your field. Okay? And then there are 2 silent stations that you would do. One is specifically to assess the professional issues associated with professional accountability and related skills around communication. So one of the stations is called professional values. Professional values. They will give you a scenario, and in that scenario, you'll be able to know that as a professional nurse on duty, if you are able to witness all these things, what actions will you take about that context? We will go into the scenarios very soon, so you'll be able to know some of the things you will do when it comes to writing the professional values. And then you have one station which is also to assess clinical, a critical appraisal of research and evidence-based and associated decision making. So basically, one other station, which is the evidence-based practice, is to show you that you being the nurse on duty, there are some research that has gone on or that has happened. And this research is talking about a particular scenario about the patient. So let's assume the patient is having an ankle sprain, and instead of taking paracetamol, they want ibuprofen. They want ibuprofen. So if they do want ibuprofen, then the article would then show why paracetamol is effective than ibuprofen and all sorts. You'll be able to figure out what the articles say. All right, that will be evidence-based practice. So together, you are getting 10 stations. As a nurse associate, you have the AI, and you have 5 clinical skills and also 1 evidence-based practice, 1 professional value. Any question up to this point? Any question up to this point? Those of us on TikTok, please join my YouTube now so that you'll be able to see the screen I'm sharing. Any question up to this point? Those of you watching on YouTube, any question up to this point? This is the timer you will see by the wall. If you make a mistake, do not panic. Make sure that you tell the assessor within the assessment time. One thing that you need to really remember in OSCE, the timer is there for you to know within a particular time you are supposed to present on that particular station. It is not there to scare you. It is just there for you to know that you need to be quick as possible. Can you revise the divisions again? The divisions are the API. You get API, which is 4 stations. And then you have 4 clinical skills, 1 evidence-based practice, 1 professional value. That is going to make it 10 stations for all nursing and midwifery skill. For all nursing and midwifery fields, yeah. But for nurse associate, you are going to get the AI. You are going to get the AI, which is assessment, implementation, and evaluation. And then you will also get 5 clinical skills, 1 evidence-based practice, 1 professional value. Any question up to this point? You can pop your questions in the comment section and I will answer you as we go on. All right? So let's read this again. Make sure that you tell the assessor within the assessment time, share what you would do it, correctly, and also it will be taken into account if it's within your time. So whatever that you are supposed to say in OSCE, you make sure that it's supposed to be said within your allocated time. If you have 5 minutes for a particular station, you make sure that you deal with the 5 minutes so well, very useful, to the point that if you forget anything, you'll be able to remember and say something before the time ends. All right? So this is the API. You have the assessment station, and you are going to do the vital signs of the patient using the News 2 chart. And you have the GCS chart for nurses. We will dive deeper. But for now, have you got any questions? Has anyone got any questions? Has anyone got any questions? Those of you on YouTube, has anyone got any question? If you're on TikTok now, kindly join me on YouTube, Nurse Obapre, and you'll be able to see the screen I'm sharing, note all the points down, and understand the overview of OSCE. Right, the 4 stations are scenario-based, and you are going to do assessment. In assessment station, as simple as possible, you are using an A to E assessment. So you are doing A to E assessment on a new admission. Someone who has been admitted to your ward, you are doing an A to E assessment on them. Let's revise ourselves a little bit. When we talk about assessment A to E, what does A mean? In our clinical knowledge, what does A mean? What does A mean? Those of you on TikTok and YouTube, what does A mean? A means airway. Good. So in assessment, you are going to begin by checking the airway of your patient. Is it patent or not? You need to make sure the airway is patent or not. Lovely. So by communicating to your patient, you'll be able to know that the airway of my patient is patent. Yeah? If the patient has got any obstruction, you would then figure out that beginning of your procedure, they are struggling to talk to you. So therefore, whatever you are doing in assessment cannot proceed because they are choking. The fact that they are able to answer you should tell you that their airway is clear. So in assessment, you are doing A to E and you are beginning with airway. Is that clear? All right. Now let's go to B. What does B mean? What does B mean? We are doing A to E. So what does B mean? Yes. Let's type it in the comment section. What does B mean? B means breathing. Thank you very much. B means breathing. And in breathing, what are we looking out for? What are we looking out for? When we talk about breathing for our patient, what are we looking out for? What are we looking out for in breathing? Yes. Anyone? You are looking out for respiration, respiratory sounds, the rhythm. Good. Perfect. Thank you. So, in breathing, you are checking the respiratory rate of your patient. You are checking the respiratory rate of your patient. So, the chest movement, yes, you are checking their respiration. And we all know from our clinical practice, checking respiration takes 1 minute, right? And then usually we don't just check respiration, we check with something else. So we can move on to circulation very soon. In breathing as well, you are checking the SpO2. Thank you very much. You are checking for the oxygen saturation as well. So these are part of the things you are going to do in your assessment station. Checking for the airway, you checking for breathing, and in breathing, you are checking the respiration and oxygen saturation of your patient. Now let's move on to C. What does C mean and what will we be checking under C? What does the C means and what are we checking under C? Yes, let's type it in the comment section. What does C mean? C means circulation. Lovely. So in circulation, what are we checking? What are we checking in circulation? What are the things we are checking in circulation? Yes. What are we checking in circulation? Those of you who just joined me on TikTok, you can watch me on YouTube live so that you'll be able to see for yourself whatever I'm sharing on the screen. Right, so we are checking for the capillary refill, perfect. We are checking for the blood pressure as well, lovely. So in circulation, we are checking for the BP, perfect. So BP, we are checking for the pulse, the capillary refill, lovely. So in capillary refill, how do we check capillary refill in case we just have to remind ourselves? How do we check for capillary refill? How do we check for capillary refill? How do we check for capillary refill? Who can tell me in the comment section? How are you going to check for Barpress capillary refill? Yes, who can type it in the comment section? Yes, capillary refill. So you are pressing the nail bed for 5 seconds and then you leave it for 2 seconds to refill. So you press the nail bed for 5 seconds and then you leave it to refill within 2 seconds. If it's going to refill within 2 seconds, they have good capillary refill. And then additional thing that you are going to do under circulation is you are checking the pallor and perfusion of your patient. So let's kindly note that as well. As part of the things you are checking for pallor, perfusion, pulse, capillary refill, BP under circulation. These are the things you are checking for. Those of you who just joined me on TikTok, please kindly join me on YouTube, Nurse Obapre, so that you'll be able to see the screen I'm sharing. All right. So now let's move on. Let's go to D. What does D mean in assessment? 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 What does D mean? Okay, I've got a question here. Do you check for urine output in C? No, you don't. You do ask about that in disability. You ask about output in disability, all right? So D is disability. And in disability, you are checking for the level of consciousness of your patient. You are checking for pain. So you remember the ACPVU. You are checking for unresponsiveness, alertness, pain. If they have any concern about pain, you are asking it in disability. If you didn't ask from the beginning, in disability, you are going to ask that question. And then you can ask about their output. Have you emptied your bowels? Additional thing that we check in disability is blood sugar. Has your blood glucose been checked? So you ask these questions when it comes to disability. Are we clear on that? Any question? Any question? Any question? Okay, good. Now let's go to E. Let's go to E. What do we check for in E? What do we check for in E? What does E mean? And what do we check for in E? When we talk about E, what do we check for? Okay, someone said I should repeat the disability. So in disability, you are checking for the alertness of your patient. If the patient is alert, confused, you are able to check that. You need to use the ACPVU. So in your clinical field, you are checking for unresponsiveness of your patient. You are checking if the patient is alert. If the patient is confused, you are checking all of that. Okay? And then you ask for pain as well under disability. You ask for pain. And you also ask about their output. Have you passed any urine? Have you emptied your bowels today? You ask them about it in disability. And then you proceed to ask, has your blood glucose been checked? Has your blood glucose been checked? You ask that question as well in disability. All right? Okay. So E is exposure. Thank you very much. E is exposure. And in exposure, you are checking for temperature. You are checking for temperature. You are checking for temperature in exposure, all right? In checking for temperature, you are going to use the infrared thermometer to check for the temperature of your patient. Additional things that you do under exposure, is to ask about bruises. You ask about bruises, skin tear, wounds, any concerns that the patient would like you to address. So basically, with all the vital signs we have checked, you are going to ask the site they want you to check and everything. So exactly. Thank you very much. That's the head to toe examination. You will not be able to undress the mannequin to ask them that, have you got any concerns? Can I check your bottom? Can I check your this? No. You will not be able to undress the mannequin to ask all those questions. Or you will not be allowed to undress your actor who is being your patient to ask all those questions. So what you can do is to ask them, have you got any bruises on you that you would like me to know of? Have you got any concerns? Have you got any wounds? Have you got a skin tear? They might have a skin tear somewhere and you would want to know about it. So you ask this question in exposure, and that completes your A to E assessment in assessment station. That completes the first phase of the assessment station, which is the A to E. A to E. That completes the first aspect of the assessment station. In documenting the assessment station, you will have the news 2 charts, and then in regards to the nurses, you have the GCS chart to do for specific conditions as well. These are the documents that you can get. There are other additional documents that you will come across in the assessment station, like the MAST chart, the SIT. We will get into it as we move on. We will just have a section for assessment, and then we'll dive deeper into it for you to get the better concept about the whole station. All right. So for now, just know that you will have a documentation to do. So the vital signs will be documented on the news chart or the GCS chart. Additionally, for the nurses, and also if you are having some specific conditions, you get the SIT and other documents as well. All right. Any question up to this point? Any question up to this point? Those of you who are watching me on TikTok, kindly join my YouTube live stream to be able to see the document I am projecting. Any question? Okay. Now, the additional thing you are going to do in your assessment station is the holistic assessment. So if you look on here, you'll be able to ask to carry out a holistic assessment. A holistic assessment. In holistic assessment, you are going to read the overview of the patient and confirm from the overview that, okay, if I read about your presenting complaints, I want to be sure that indeed the presenting complaints are true. So you read the overview and confirm from the patient. I will show you documents about what I'm saying, the overview, very soon. So you'll be able to see how the assessment documents look like. And then the overview will be read to the patient to also confirm what exactly the patient would be experiencing, or what you have, is it accurate or not. You want to find out that if the patient presented with shortness of breath, you want to find out that indeed it is true. All right. So that is the holistic assessment aspect. It's just a very quick reading, but you also do further referrals. You will have to also educate your patient in the midst of you reading the holistic assessment. So put it at the back of your mind. In assessment station, you are doing in 2 ways. You are presenting on a holistic assessment and an A to E assessment on the patient. So head to toe examination, which is the A to E, and then you also conduct the holistic assessment for the patient. Any question about assessment up to this point? Any question about assessment? Any question? Okay, so let's go to this document. These are the conditions you will get. These are the conditions you are going to get in your OSCE. So you can see the field is on the left-hand side, and then the time that is allocated to each of the stations is also here. For adult nurses, just like I mentioned before, you are going to have the API under one scenario. For adult nurses, you are going to have the API under one scenario. All right. So just like you see here, the patients can either have Alzheimer's disease, chronic heart failure, community assessment, ectopic pregnancy, end of life, suspected deep vein thrombosis, hernia, homelessness, pneumonia, or subdural hematoma. So you can have any of these 10 stations as your assessment. Is that okay? Does it make sense? Okay, I've got questions here. Is this applicable for mental health OSCE as well? Yeah, we will see. Mental health OSCE will also be doing the same thing. So just like you see, they will do the API as well. So these are the conditions they will get. So yes, they do the same. Do you do the holistic assessment before the A to E? No, you do the A to E before the holistic assessment. You do the A to E before the holistic assessment. Any further questions before I proceed? Any further questions? Those on TikTok, if you have questions, if you have concerns, I'm sharing a screen on YouTube, so it would be lovely if you join my YouTube stream. Any questions up to this point? Yes. Mental health are also getting the API, but you have, kindly join me on YouTube and you'll see the screen, all right? Those of you here on YouTube, are you able to tell me if you have any concerns? Any question? No? Yes? Do we all understand up to this point? Is it very clear? Okay, perfect. All right, so just like I was saying, in API, since it's fused together, you can get conditions like Alzheimer's, chronic heart failure, community assessment, ectopic pregnancy, end of life, suspected deep vein thrombosis, hernia, homelessness, pneumonia, and subdural hematoma for adult nursing. So whoever is going to write adult nursing exam can get any of these stations, any of these scenarios. So your scenario can be about ectopic pregnancy. And in your API presentation, whatever you will do will be ectopic pregnancy. Do you understand? Whatever you will do will be under ectopic pregnancy. Yes. What I just explained is for assessment. Yes. Is that okay? Now, with assessment, you have 20 minutes for the station. You have 20 minutes for the assessment station. Planning, you have 14 minutes. You have 15 minutes for implementation and 8 minutes for evaluation. Very, very important that you note this. The timings allocated to every station needs to be practiced alongside, because you wouldn't want to talk a lot and skip saying the salient stuff that you are meant to say. All right. Now, for mental health nurses, with your API station, you are getting depression and suicide ideation, bipolar disorder, and anxiety. So any of these conditions will be part of your API. You can get one of these conditions as your API presentation. All right. Learning and disability nursing, you have behaviors that challenge and then Down syndrome. Children's nursing, you have asthma, post-tonsillectomy bleed, and child fever. This is how you are supposed to learn your OSCE. There is a fire station that you might have to follow to know that whatever condition that you get, there are suspected clinical skills under those conditions. So as and when we move on to this live session, you'll be able to know what to expect. Okay? Any question about the API timings? Any question about the API timings? So that is the API all done for the assessment section. Now, let's move on to planning. Let's move on to planning. Let's move on to planning. Planning, this is a silent station and you'll be monitored by the invigilator or assessor. So sometimes in your planning station, the assessor will just time you and leave you in the room to do the station. And just like we got to know, the planning station is 14 minutes. You have 14 minutes to write 2 relevant aspects of care related to the scenario from the assessment station, which should include associated relevant self-care. Make sure that you familiarize yourself with the template provided by the NMC. So there is a planning document that you are going to use to write your care plan. There is a planning document that you are going to use to write your care plan. In planning, you are basically looking out for 2 relevant aspects of care. There is a whole lot of presenting complaints that the patient will come with. The patient can come with impaired mobility, self-care deficits, shortness of breath. The patient can come with pain. All these things might be the concerns of your patient. But what are you going to do? You need to sieve it and prioritize the problems and write amongst all the presenting problems, you write 2 relevant care plans for them. Do you understand? So you don't just choose anything. You are going to prioritize the problems that the patient is going to present to write the care plan for them. Does it make sense? Does it make sense? Mind you, as a nurse associate, you are not writing planning. You are not doing planning as a nurse associate. So this is for all nurses and midwives, all form of nurses and midwives. You are doing planning. In the planning, you are looking out for 2 aspects of care. So let's just do a little bit of exercise right now. Let's do a little bit of exercise. The patient presented with shortness of breath. The patient presented with shortness of breath, risk for infection. So they have a form of infection or they are at risk of the infection. Let me put it this way. The patient presented with shortness of breath, impaired mobility, chest pain, and loss of appetite. Shortness of breath, chest pain, loss of appetite, and impaired mobility. These are the concerns that you will see in the assessment station or the planning scenario of your patient. These are the concerns you will see. So what are the problems you will select to write the care plan for your patient? What are the problems? Impaired mobility, shortness of breath, impaired mobility, shortness of breath, chest pain, and loss of appetite. Which of these are you going to write a care plan about? Let's type it in the comment section. Amongst these, okay, you are going to write about shortness of breath. Okay, who else? So select 2 of these. You have impaired mobility. Okay, you are choosing shortness of breath and chest pain. Okay. Someone is also choosing risk of infection and shortness of breath. Okay, right. So one thing is, in selecting or mentioning the problems, if you are unable to prioritize, you can fail the station. If you are unable to prioritize, you can fail the station. The reason being that if you are going to look at a patient, those of you who chose risk for infection, all right? If you are looking at a patient who is in distress and has chest pain, and you are going to plan a care for impaired mobility, loss of appetite, or risk for infection, then there is a question mark. Because by the time you get to the patient, the pain can aggravate to its worst stage. And we are talking of chest pain that has got relation to do with the heart. Shortness of breath. If you skip shortness of breath, the patient will die. By the time you are going to look for food for the patient will be gone. So the main thing here is to sieve amongst the problems and see how best you can prioritize it. That is what planning is about. If you are unable to identify the problems in that order, you will fail the station. So those of you who chose chest pain and shortness of breath, well done. That is the problem you are going to select. You are selecting chest pain and shortness of breath for the patient at this moment. And then the others will just follow. But during OSCE, since they expect you to write just 2, you are selecting these 2. Is that okay with everybody? You mention the patient's name and write about the problem. So yes, when we get to the planning station to explain further, you'll be able to know how to write a good care plan. Okay? So that is how you go about it. You select the main problems. So now we have shortness of breath and we have chest pain. Okay, question. Are you presented with all the patient's symptoms in the scenario, or you will identify them during the assessment? Good question. Thank you for that question. So sometimes if the patient presenting complaints on the overview of the assessment, sometimes in the patient presenting complaints, they might have, let's say, shortness of breath and then impaired mobility. That is what the patient presented with on the overview chart: shortness of breath and impaired mobility. Now, when you were doing the assessment station, you asked the patient, "Are you in pain?" And the patient said, "Yes, I've got chest pain." So far as the patient has said they have chest pain, and you knowing that the assessment, planning, implementation, they work together, you'll be able to write the pain as part of your problems, even though it's not on the presenting complaint. The patient verbalized it during your assessment station. Sometimes too, they will give you a scenario in the planning station. So you'll be able to know that this is my planning station. As at this point, if the patient has gone for surgery, they have come back. If the patient is yet to go for surgery, all these things will be stated in the planning scenario. You can figure out the best problem that is suitable. If before the patient was experiencing sharp abdominal pain and they needed to go for an ectopic pregnancy surgery, emergency ectopic, they had the surgery, it means as at then, the planning station will probably change from a pre-op to post-op. That is when you would then figure out how best you can write the planning. But in general, you will pick the planning scenario and figure out if you can see some of the problems in the scenario. If there is none, you will pick some from the assessment station. If you don't get some there, then you will remind yourself from the presenting complaints as well when you were doing the assessment. But it is unlikely of you not to get any problem in the planning and then the presenting complaints. You will definitely get all the problems there. Otherwise, you will definitely get something said by the patient. Is that okay with everyone? Are we okay? Yes, good. Okay. Samuel, are you all right? Is your question fully answered? Perfect. Good. So that is what you would do in your planning station. Okay. Now let's move on to implementation. If there is no question about planning, can we move on to implementation? Can we move on to implementation? Okay. In implementation station, in this station, you'll be implementing care such as administering oral drugs. In this bay, your patient may either be represented by an actor or a mannequin, and either the actor or assessor will respond to you from the script. So let's say they present that your patient is called Araba Lawson and the date of birth is 10th March 1945. The whole presentation, you are going to look at the mannequin. But when it comes to them responding, the assessor will then respond for you. All right. In implementation, you are serving oral medication. You are serving oral medication. Note this, nobody is going to serve subcutaneous whatsoever injection. In implementation station, you are strictly serving oral medication. Is that okay? In this station, it is in 3 parts. It's in 3 parts. The first part, so in the same station in 15 minutes, the first part, I have categorized it into 3. The first part is when you read the whole prescription and identify the type of medication you are supposed to serve within your time. The second part is when you will go and dispense the medication from the drug trolley. When you go and dispense the medication from the drug trolley, that will be the second part. And the third part is administering the medication to the patient. That is what you will do in implementation. This is a performing station, so you'll be talking throughout. In our subsequent live sessions, we are going to pick the station one after the other, and then we'll dive deeper on how to present on those things. The first part again, the first part is you reading a booklet of prescription. And this booklet is going to talk to you about the particular medication the patient is supposed to take within your time. So they will give you a scenario to say that assume it's today and it's 14 o'clock. That means that every medication you are going to serve is going to be 14 o'clock. Or you are looking at the prescription to find out medications that are due at 14 o'clock. That is all you are looking out for. There are some things that you would have to read and acknowledge as you go on, but you are basically reading through a whole booklet of prescription to find out what to serve. Any question about the implementation overview? Any question? Any question about the implementation overview? Yes, any question? No? All right. Those of you on YouTube here, any question? Any question about the implementation? Okay, good. Thank you. Someone has got a question on TikTok. Are you allowed to mark the meds you'll be given as you are reading it out? I would say no, because you are not supposed to document or write anything that you've not done. You just note it in your head. If you pick the prescription, you'll be able to see that I read Ramipril, so I think I will serve Ramipril. Your mind should be very active during your OSCE presentation. So this will enable you figure out what exactly you are going to serve. Don't put anything on the chat. You don't know how it's going to look like when they are watching the video. It's either they will see it as you are literally documenting before giving the medication, which is not really accepted. So that's not what you would want to do, all right? You would want to make sure that everything is done perfectly. So make sure you do not put anything on the sheet. Just memorize whatever you are doing and go ahead and present, yeah? Any question about the implementation again? Those of us on TikTok, kindly come to YouTube so that you'll be able to watch what I'm projecting on the screen. Nurse Obapre on YouTube. Make sure to go to my YouTube channel now. All right, now let's go to evaluation. This station is a verbal-based station, and you'll be monitored by the assessor. In this station, you will write notes about a transfer, discharge, or other form of evaluation, and you are using the S bar which is situation background assessment recommendation to hand over the patient's care in general. So when you are doing evaluation, you will be given the assessment paper, planning paper, implementation paper, and you would hand over the care to the person who is taking up. You can either have a doctor, you can have your colleague who is taking up from you. It depends on how the scenario looks like. So either a doctor, a colleague, or you are transing in, transing out, all these things come in play. If you are discharging the patient to a care home, if you are transferring the patient from your ward to a different department, if you are referring the patient and they need to leave your ward, everything that you are doing, you will hand over everything about the patient. So let me just give you a quick glance of the SBAR. In SBAR, it follows a systematic way of how you hand over the patient's care. Follows a systematic way of how you will hand over the patient's care. So we know that the patient in assessment, let's say it's pneumonia. The patient in assessment, we notice that the patient has got, the name is Araba Lawson, date of birth is 10th March 1945, the diagnosis is pneumonia. What else have we noted about the patient? The reason for handing over is the patient leaving your ward to do something in a different department. That will be your reason for handing over the patient's care. Is the patient leaving your ward to the house or to a care home? Whatever reason that is attached to the scenario must be acknowledged in the situation. So it goes like you are going to talk and explain what you would do for the patient. You are going to talk and explain what you did for the patient and project what the nurses or whoever is taking up from you should continue to do for the patient. Sometimes you can either see something like you are handing over for continuity of care to your colleague from the same ward. You are handing over for continuity of care. If that is the case, it means that you are not going to call, you are not going to say anything extraordinary. You are literally going to welcome the person who is going to take up from you. And then you talk about a new admission today. Name is Araba Lawson, date of birth is this, and then a diagnosis of this. I'm handing over for continuity of care. You mentioned the salient stuff. And then in the background, you will read the overview that you used for the holistic assessment. Mind you, I mentioned that the overview of the assessment, you will have a whole booklet talking about the presenting complaints of your patient. It will talk about the medical history, the past medical history, and then the allergies and everything about your patient will be on there. So what you would have to do is literally just to make sure you read it to whoever is taking up for them to note a few bits and pieces down. Yeah. And then in assessment, what are the vital signs that you did for the patient? The vital signs you did for the patient before, which is previous vital signs. And then in the evaluation station, they are going to give you current vital signs. They are going to give you current vital signs. So you'll be able to know the current vitals and compare with the previous vital signs. If there's anything that you would want them to further check, you would acknowledge it as such. So let's say their SPO2 previously. Yes, the SBAR is the acronym. Situation, background, assessment, and recommendation. That is the acronym. So let's say the SPO2 in assessment was 96%. And then currently you started doing the vital signs and you notice that in the evaluation station, they've given you the current vital signs of your patient and it's 92. So it has become something of a concerning matter. What you would then have to do is to make sure that you acknowledge it and tell whoever is taking up from you, whoever is taking up from you to pay attention to that and check it or monitor. So that's what you are going to do. Now let's move on to recommendation. Recommendation, you will talk about all the referrals that you did. So the referrals, just like I mentioned, whilst you are reading the holistic assessment, you will be referring the patient alongside when needed. So the referrals that you did, you will be able to mention all of them here. All right. And then the next thing for you to do is to also tell them the referrals they need to do for your patient. The referrals they need to do for your patient. Some of them you were able to do, some you couldn't do it. All of it you need to hand over. Let's say you needed to refer the patient to the nutritionist. You needed to refer the patient to the occupational therapist. But you also needed to refer the patient to the pain management team and also the respiratory team. If you were able to do all of these, respiratory team, pain management team, you did that, but you were unable to do the nutritionist and the occupational therapist, then you can recommend. I recommend that you refer Araba to the nutritionist and occupational therapist for a better plan of care. So that is what you would literally do or talk about in the recommendation section. It's 8-minute station, very simple. It's talking about the same patient that you treated or you've been with throughout. So there are some of the things you wouldn't need to write notes about because you've got them off head. You've done their assessment, you did the planning about them, you did the implementation, and also you are now handing over. So it's very easy for you to flow because you did everything on them. Does it make sense? So that is what evaluation is about. Any question or any concerns? Any question or concerns? Any question or any concerns? Please, if you have question, type it in the comment section. Do we all understand up to this point? Do we all understand API up to this point? We are now going to clinical skills. Do we all understand API up to this point? Okay. Perfect. Now, let's move on to the clinical proficiency or the clinical skill. What is your question? Those of us on TikTok, any question? Any question? Yeah, type your question. Type your question before we proceed. Okay, so we are now going to the clinical skill. Just like I mentioned for adult nurses, you are doing 4 clinical skills. So all nursing fields, you are doing 4 clinical skills. All nursing fields, with the exception of nurse associates. Nurse associates are doing 5 clinical skills. Okay. So all fields, midwives are doing 4 clinical skills, nurses, mental health, every nursing category is doing 4 clinical skills. All right. Now let's get to what this clinical skill really means. We gave an overview about planning. We didn't write a care plan. But the answer to your question, please, can you explain the reevaluation time frame? It should be 24 hours. Okay, so clinical proficiency. You'll be assessed on 4 clinical proficiencies. Typically, you are going to have any of these as part of the clinical skills. You will have any of these. So this is what we will be doing in the next couple of days. We will pick station by station, and we will have a live session about each station. You jot all the points down so that you'll be able to pass your OSCE very simple. All right. That's what we will be doing in the next couple of days. For adult nursing, you have administration of inhaled medication, administration of suppository. Yes, we are on YouTube. Nurse Obapre on YouTube. Somebody, those on TikTok, type it in the comment section for them. Nurse Obapre on YouTube. So you can join and look and see the screen I'm projecting. Right, let's continue. So we have administration of inhaled medication. What is administration of inhaled medication? You are going to serve inhaled medication to your patient. You are going to serve inhaled medication to your patient. All right. Now let's move on. We have administration of suppository. You are serving suppository medication to your patient. We have suppository here. So you are serving something like this to your patient. And this is a basic nursing stuff that as a nurse, you would have to know, or you would definitely know. We have aseptic non-touch technique and wound assessment. That is the ANTT. So this is the wound dressing aspect. So you go and assess the wound and you come back to dress it aseptically. That is aseptic non-touch technique. We have blood glucose monitoring. You are going to check the blood sugar of your patient in this station. Bowel assessment is a silent station. So you'll be able to assess the bowel of your patient, write a care plan to manage their care. So you can have something like a diarrhea stool, which will be given. And then if your patient is experiencing diarrhea, what are you going to do as the nurse on duty? We have catheter sample, catheter specimen of urine collection. You are going to take a sample from the catheter that's in situ of your patient. The catheter in situ of your patient, you will take a sample from it to identify whatever the clinician want to do. You just take the sample and send it to the lab for further investigations. And then you have fluid balance, which is intake and output. Hospital admission is off now. So you have insertion of NG tube. There's no hospital resuscitation. Insertion of NG tube, IM injection, intravenous. So we have VIP and IV flash, intravenous bolus, and then visual infusion phlebitis. You are going to assess the cannula site of your patient for signs of phlebitis, and then you will give them an IV flash. You have your midstream urine collection. nutritional assessment. This one is out. Nasopharyngeal suctioning is also out. So you are not going to do that. You get nutritional assessment, oral care plan, oxygen therapy. You are going to administer oxygen to the patient. Pain assessment, peak exploratory flow rate. You are using the peak flow meter to check and assess for any concerns of the breathing or how well the patient's lung is able to expand. So you are going to use the peak flow meter to do all these things. That's what you would do for your patient. All right. The next thing is pre-operative checklist. This is a new station that was added to the nursing marking criteria. Pre-operative checklist. Just like the name goes, the patient is undergoing surgery. So what checklists are you going to tick off to make sure that the pre-op management is solid? Pressure area assessment is a silent station. So that's what you are going to do for the patient. You assess the tendency or the capacity of the patient and also know how well the patient is prone or not prone for pressure sores. You have removal of urethral catheter. You are going to take off the urinary catheter of your patient as directed by your physician. We have subcutaneous injection, midstream urine collection and urinalysis. This is a station where you take a sample from your patient and assess whether the patient has got leukocytes, blood, and all the other things on the reagent bottle. This is the this is the clinical skill that you are going to expect. So before the sheet I was projecting before was the previous document. This one has the anti-embolism stocking as part of the adult nursing station. That is also a new station that was added. Anti-embolism stockings is also part of the things the nurses will be doing. So basically, let's count how many stations nurses are going to do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21. This is 2 stations together. So basically, it's 22 stations for nurses. Adult nurses, you have to learn 22 stations, and out of the 22, you are expecting 4. You are expecting 4. You need to get yourself acquainted with all these stations because as part of your clinical practice, being a nurse on duty, you are supposed to be able to know all these things. Is it overwhelming for you? It is very simple. If you know the preamble, you just blend it and then you'll be able to flow very easily. So that's how you go about it. These are the 22 stations for adult nurses. Any question, adult nurses? Any question? Yes, any question in TikTok? Any question on YouTube for adult nurses? The clinical skills, we've mentioned all of them. Any questions? Are we all okay? Is that clear for everyone? So in the subsequent sessions, we will take station by station and then we'll have a live detailed session about all of them, all right? Is the catheter specimen of urine collection different? Yes, it is. Just like you see, every station stands on their own. So they are all different. They are all different. you see that only wound assessment and ANTT are together. So that one, you will do it together. Other than that, every station comes separately with the allocated time. Yeah? Good. Any further questions? Any further questions? Those of you here on TikTok, I'm projecting a screen on my YouTube channel. So it will be lovely if you are able to come to YouTube and watch. Yeah, we will project for midwives as well. This one is for all nursing. So mental health nursing, you have these clinical skills to study for: de-escalation, nutritional assessment, reminiscence therapy, talking therapies, physiological observation, and intramuscular injection. This is what you will get, mental health nurses. You will have these 1, 2, 3, 4, 5, 6 to study for, and then you have 4. You have 4. Learning and disability, administration of suppository, de-escalation, IM, nutritional assessment, physiological observation, and talking therapies, and then pain assessment. These are the things you will get in learning disability nursing. These are the things you are looking out for in your OSCE. And then children's nursing, IM, AIM, which is administration of inhaled medication, blood glucose monitoring, fine bore NG tube, oxygen therapy, peak exploratory flow rates, and then subcutaneous injection. This is what you guys are also looking out for. So basically, adult nurses have got a lot more to study than any other field. As an adult nurse, they expect you to be able to do a lot more than any other field. So if you are an adult nurse, be very proud of yourself, whatever thing you have accomplished. Because there is a lot more, because you are a general nurse, there's a lot more to expect from you than any other field. All right? Any question up to this point? Has anyone got any concerns? We have talked about all nursing fields. We will now talk about the midwifery. We have talked about all nursing field. We will now talk about midwifery and then nursing associates. Midwifery and nursing associates. Any question? Okay. Well understood. Thank you very much. Now, let's project midwifery. For the midwives, this is your timings as well. So with your station, you are expecting under the API, antenatal admission, labor and birth, and postnatal visit. These are the conditions you will get under your API for midwives. Remember, for the nurses, we had 10 conditions so far. We had 10 conditions, but for the midwives, you've got 3 here, and then you are going to look out for all these: antenatal admission, labor and birth, and then postnatal visit. All right. Now let's move on to your skills. This is the skills you are going to get. shoulder dystocia, postpartum hemorrhage, birth, complex birth, postnatal care, postnatal check, intravenous, and so it's the similar station for nurses as well, which is the VIP and IV flash. That's the intravenous flash and then visual infusion phlebitis station. You have intramuscular injection as well. So we have similar stations like the nurses. We have removal of urinary catheter, which is similar to the nurses as well. And then systematic physical examination of a newborn. That one nurses don't do. We haven't got anything to do with new babies. So we don't do that. And then you will now do the neonatal assessment as well. So these are the clinical skills you are going to learn, and then you will get 4 out of them. So we have how many? 2, 4, 6, 8, 10, 11. Midwives have got 11 skills to study for, and out of the 11 skills, they are going to get 4. That is what you are expecting as a midwife. All right. Now let's go to the chat box. Any questions from the midwives? Emilia, any questions from the midwife? Has anyone got any question? Any question? No. Okay, good. There are no questions on TikTok as well. Lovely. So now we can now proceed to the nursing associate marking criteria. What are the nursing associates going to get? I've always been saying that Nurse Associate OSCE is one of the simplest OSCE to pass. And I'm never going to say otherwise. The reason being that your stations are very simple. If you notice the few changes that they make here and there in the other fields, the Nurse Associate got one major change in the clinical skill just this month. So a couple of months ago, the nurse associates were getting the AI. So AI, you have the hospital admission, and then you do the assessment, implementation, and evaluation on the patient. And then as soon as you finish, you are having these 6 clinical skills. Before, it was 5 clinical skills, but now you have 6. You have 6 clinical skills to study for, and out of the 6, you are getting 5 of them. With the 6 clinical skills, you have administration of inhaled medication, which is similar to the nurses as well. You have the hospital admission, you have pain assessment, fluid balance, pressure area assessment, and intramuscular injection. This is what to expect as a nurse associate. You have hospital admission. That is literally the only different station. So nurses and nurse associates have got all the other stations in common. Nurse associates have got administration of inhaled medication, pain assessment, and hospital admission, and fluid balance, pressure area assessment, intramuscular injection. All these stations, with the exception of hospital admission, you can have it as a nurse as well. So it's quite easy to study with a nurse on these 5 clinical skills. All right. So that is what you are expecting. Whilst we are already in the table of content of the nurse associate, let's talk about the professional values. For nurse associate, you get 1 professional value, 1 evidence-based practice. And looking at your marking criteria, the professional value you are going to expect is just confidentiality. And then evidence-based practice is diabetes. You are expecting just 1. You are looking out for 1 evidence-based practice, 1 professional value, and that is exactly what you see in the marking criteria. Now let's go to the midwives. What are the midwives getting when it comes to evidence-based practice and professional values? What are the midwives getting? The midwives will get professional value, bereavement care, safeguarding women and children. These are the 2 stations that you can get. And in professional value, you are getting 1. They won't give you 2, you are getting 1. So mind you, you will literally have to study for these 2 and expect just 1 of them in your exam. And then for the evidence-based practice, you have for the midwives, you have place of birth, induction of labor at term, and smoking and pregnancy. These are the 3 evidence-based practice that you'll be looking out for in your OSCE. Is that okay for midwives and nurse associates? Are we okay? Any questions? Any questions? Okay, we are okay. Perfect. Now let's go to the nurses. Let's go to the nurses. So, what is a nurse going to expect? After learning the 22 stations, let's go to our professional value and evidence-based practice. The evidence-based practice, we are expecting all these to be part of the nursing fields. So just like you see here, it says all nursing fields. So the code is here. So if you are an adult nurse, that is RN1. A mental health RN3, just like that. Learning and disability, you have RN5. Children's nursing RN8. So these are all together. So it's quite overwhelming to see, but at the same time, some of them are going to be allocated to learning and disability. Some of them will be allocated to the children's nursing. Some of them will be allocated to the mental health. And then adult nursing will also take some of them. So you might not face or you might not see all these. Mostly for adult nurses, you might have to study about 8 of these and expect 1 of them. Because if you are an adult nurse, you are not going to get some of the conditions that you see here. Cholesterol and coffee, I've never seen an adult nurse get it before. So basically, adult nurses can get like ankle sprain, bedside handover, cervical screening, dementia and music. You can get diabetes, fever in children, restraints, saline versus tap water. These are some of the things you can get, and maybe smoking cessation. The other skills or the other stations in the evidence-based practice is for the other nursing fields. So I'm going to go over again. For the nurses, adult nurses, you are going to get ankle sprain, bedside handover, cervical screening, dementia and music, diabetes, fever in children, We have restraint, saline versus tap water, and somewhat smoking cessation. These are the things you are going to get in your evidence-based practice. Samuel, have you understood? Any question from those of us watching on TikTok? If you want to see the screen, please do well to join us on YouTube, Nurse Obapre. Samuel, have you got a question? Any question? Right, let's go to the professional values. Just like you see here, it's for all the fields of nursing. So professional values, you get bullying and all sorts, deterioration patients, drug error, falsifying observation, falsifying timesheet, hospital food, impaired performance, lab results, patient private details, possible abuse, racism, social media, witness abuse, and recognizing signs of professional burnout. So these are the expectations. But however, as an adult nurse, you might get something like bullying. You might get something like falsifying observation, falsifying timesheets, hospital admission, impaired performance, lab results, racism, social media, witness abuse. That's a little bit tricky, but you might get something like that. So that is how the professional values is. You are getting one of these. So the scenario will be given to you in your professional value station. It's a silent station and it's 10 minutes. The scenario will be given to you. And then in the scenario, what you are going to check is the type of concept or the type of station or the heading I'm looking out for. So the scenario says that, let's cite an example. Okay, you are a nurse at the ward. I'm going to zoom this for you to pick one of the things I'm talking about. Can you see all the stations very clear now? Okay. So it says that you are a nurse at the ward and you are working with a colleague. You notice that your colleague has gone and stood beside a patient and then came back to say that, oh, I've checked the patient's vital signs, and you saw them documenting on the chat. You saw them that they documented the chat. Meanwhile, upon seeing them go to the patient, you notice they didn't check the vital signs. They didn't take anything to check the vital signs with, but they just said, oh, I went to check this person's vital signs, and they documented. So that is a little bit of a scenario I've just created. Amongst the conditions that you are going to get, which of these can you select as part of that relates with the scenario I just gave? So amongst all these, which one relates with the scenario I just gave? Yes, let's type it in the comment section. Which one of these relates with the scenario I just gave? You are on duty at the ward with your patient and another colleague, and you notice that the patient's vital signs was documented, and then the nurse said, oh, I did it. Meanwhile, you saw the nurse went there and didn't do anything. But they said, oh, don't worry, I've done it. So what context am I talking about here? Perfect. Falsifying observation. So that is how you figure out what you are doing. The scenario will just give you the heads up and you'll be able to know what exactly you are doing. If it's falsifying observation you are doing, then what are you going to do about it? Then you write 5 solid points on what you would do about it. So just like I mentioned, in our subsequent live sections, we are going to take stations by stations to dive deeper so that you get the full understanding about OSCE. So that is how the falsifying observation is figured out, all right? And then when it comes to your evidence-based practice, that one, the scenario will also determine what exactly is talking about, whether it's cervical screening, ankle sprain, bedside handover, whatever being the case. It will be easy for you to identify because you have read the marking criteria for all the evidence-based stations. So you have familiarized yourself with all of them before your OSCE exam. This will make it very easy for you to pass this station. So that is making in total, that is 10 stations for all the fields, nurses, all form of nursing fields, and nurse associates, midwives. That is the general overview about OSCE. That is the general overview about OSCE. This is what you are going to expect in the OSCE station. This is what you are looking out for. This is what you are going to be assessed on. Now, we have room for questions. Any questions or any concerns about the overview presentation? Any concerns? Have you got a question so far? So now, have you got the whole concept of OSCE? At least, have you got a fair idea about what OSCE is? If someone should mention to you that I'm going to write my OSCE, you'll be able to know that, oh, then you are expecting 10 stations. Amongst the 10, you are getting API, you are getting 4 field stations, which is the API, you are getting 4 clinical skills, which is any of the ones that we mentioned, and also you are getting 1 professional value, 1 evidence-based practice as a nurse, all form of nursing and midwifery. You are expecting this. And as a nurse associate, I'm expecting AI. I'm making sure that I learn AI, and also I am expecting 5 clinical skills and 1 professional value, 1 evidence-based practice. Right, let me know in the comment section if you have any question or any concerns so far. Any question or any concerns? Any question or any concerns? Have you all understood the overview of OSCE? Have you all understood the overview of OSCE, especially those who joined me from the beginning? Have you all understood? Yes? Okay. Can we comment? For mental health, you are expecting what you see. So this is for all nursing fields. The evidence-based practice, this is for all nursing fields. Okay? This is for all nursing fields. So you can get any of these. And then this is also the professional value for all nursing fields. You can get any of these. Right. So now we can all say that we have a fair concept about OSCE and what to expect as a nurse, nurse associate, midwife, mental health, all the fields of nursing. At least we can boast off to say that we have got a fair concept about what OSCE is. All right. So that will be the end of this stream. God willing, in our subsequent stream, we will dive deeper. We will take a station each and dive deeper on how best we can do the station and pass once and for all. Okay, that is what we will be doing in the next couple of days in this month. Hopefully by the time that we finish, every one of you will have a fair idea to write your OSCE and pass on your first attempt. That is the goal. So that will be the end. God willing, maybe tomorrow, since you guys have subscribed to the channel, click on the notification button. Make sure, if you've not subscribed, make sure to subscribe. Click on the notification button. As soon as I come on live, you'll be notified. Maybe tomorrow I'll be here by 6 to 8. Hopefully we will have a 2-hour section to dive deeper about any station. So this is what we are going to do. Those of you who have the quest to join the streams every now and then, do well to also comment under my videos on TikTok. Let me know if you want a particular station to be done or treated, since you might have a lot of fear on that. Then we can treat it earlier, because I've planned to take it from like API. But some people would want us to do clinical skills. So maybe we can all decide together, should we begin with all the clinical skills and make sure that we have sorted ourselves with all the clinical skills moving forward, and then we'll spend time to do the API. So Nancy, you can follow me on TikTok, contact the number on my recent flyer, and you'll be able to join our OSCE class, yeah? Yeah, any question, any concerns? Any question or concern so far? Have we all been fed well with the overview of OSCE? Okay, thank you. You're welcome. All right. Are we all okay? Can we end the stream now? Are we all okay? Perfect. So 6 p.m. tomorrow, we can make another section and then talk about a particular station, God willing. I will confirm the stations. We will begin with nursing. But one thing is, there are some of the stations that are similar with nurses and nurse associates. So we are likely to begin with those stations so that it will be general for all of us. Yeah. So if we begin with those stations, you'll be able to, everybody can figure out what to actually do on each station. Yeah. Thank you everybody for joining this live stream. I do appreciate your time, and I hope that whatever we did here has been extremely useful for you all, and then you'll be able to boost your confidence and build up on yourself as you prepare for your OSCE. I do wish you all the best and good luck. Make sure to subscribe to this channel if you've not, and leave a few likes. Comment under the live video that I will post. Comment under it the stations that you would want me to treat, or you would want me to do for you to boost your confidence on that particular station, and I'll be happy to do that. So I do appreciate all of you. Thank you so much. I'm going to end this live stream. You can join me back on TikTok if you want. Thank you, everybody.